welcome to the Plastic Surgery Practice Podcast on the MedCore Podcast Network. I'm Keri Stevens, the co-chief editor of Plastic Surgery Practice. Today, I'm talking to Dr. Michael Tantillo, a board-certified plastic surgeon and founder of Clareo Center, about one of the hottest trends in plastic surgery, buccal fat removal. Dr. Tantillo, thank you for joining us today.
Oh, thank you very much for having me. It's a pleasure to be here.
Yeah, we're excited. So let's start. Can you just talk about your practice and the procedures you most commonly do?
We're a plastic surgery practice. We have two surgeons. We're in Chestnut Hill, Massachusetts. We focus on aesthetic surgery of the face, breast, and body. Our most common procedures are probably breast lift with augmentation, tummy tuck, liposuction, facelift, and eyelid surgery. We also do some minimally and non-invasive procedures in the office, such as injectables, such as things like radio frequency, collagen tightening, that can be applied to the face or the body. So that's kind of an overview of the practice.
So let's get into the crux of this podcast, which is about buccal fat removal. It seems that this trend, it's become a trend out of nowhere. One day buccal fat removal was barely talked about by the general public, and then it becomes a TikTok trend. So what has led to the popularity of buccal fat removal, and why is it Gen Z that's really propelling this trend?
Well, buccal fat removal's been around for decades, really. I mean, we've been doing buccal fat removal for quite a long time. People who are interested in slimming their midface, slimming their cheek area, are people who are interested in buccal fat removal. What makes something go viral? I mean, who knows? You can ask that question about anything, and uh, there's plenty of things that have just been kind of lying around for a while, and all of a sudden they get picked up and they become popular. Um, the younger patients are they're more open-minded, or embracing aesthetic procedures, if you will. Um, and buccal fat removal is a quick procedure, very minimal risk, minimal downtime, has reliable results that many people like. So it's just right now, at least, is there is a heavy drive towards slimming down the mid face, and avoiding the round face look.
Well, you mentioned minimal risk, but are there any patient populations that, aren't good for this procedure and that kind of should avoid the buccal fat removal?
No, not in general. I mean, the anatomy is pretty consistent. The procedure, when done by a properly trained surgeon, is safe. I mean, it is the face. The one has to be familiar with the anatomy, or there can be there can be complications. But with a properly trained plastic surgeon, the, those are very, very minimal. Generally, an office procedure, do it under local anesthesia. Sometimes patients get a little bit of sedation, some Valium or something like that. Um, the procedure takes 30-45 minutes, and then quick recovery. But it's a procedure that can be applied to really any and all broad groups of patients.
Okay, so you said it's short. Can you explain what exactly happens in a buccal fat removal procedure?
Yeah, so it's the procedure kind of describes the name kind of describes the procedure, which is good. We like that. It keeps everyone on the same page. So the buccal fat pad, it's actually a pretty big fat pad in the mid face, and really extends up into the temple area. But so it's not a complete removal of the fat pad. It's a partial removal of the fat pad. And that fat pad just lies in the mid face, in between the muscles. It's easily accessible through an incision inside the mouth, so obviously there's no visible incision or scarring there. um, and the fat is teased away, and the surgeon takes out as much fat as she or he thinks is warranted to accomplish the aesthetic goal.
So, how do they hold up over time? And are patients generally satisfied post-treatment? Is it kind of one and
Hmm.
done? Buccal fat's gone. Okay,
Yes, it's a one and done thing. You don't grow back the buccal fat.
great.
Now, obviously, if somebody were to gain a lot of weight, I mean, their face would get, they gain some weight in their face, right? I mean, so, um, but you're always going to have, your mid face, your mid cheek area is always going to carry less weight than before the procedure. So it is, yeah, it's a one and done thing. The patient satisfaction rate is really high because I think a pretty easy. It's pretty easy for patients to envision what the procedure's going to do, right? I mean, they know, and as you said, it's sort of all over the place with the virality of it. So people kind of have seen a bunch of the results, and they're reproducible. Because, like I said, that fat pad is pretty consistent anatomically, and so people kind of know what to expect, and the surgeon can, with pretty rare exception, deliver that. So that makes a high satisfaction procedure.
Do you typically, when you have a buccal fat removal patient, do you typically point them into the med spa route too to hold up any of these results, or to kind of after buccal fat removal, do people typically, do injectables? I know that the buccal fat is gone, but is that something that you see a lot of, where people go and then injectables route after that?
Well, they certainly can because I mean, obviously, everything is a balance in the face, and so yes, there are areas of the face where we lose fat and volume over time, and so
Right.
those areas just, I mean, patients with or without buccal fat pad removal, patients are interested many times in some volume rejuvenation and restoration in other parts of the face. uh, and so, yeah, buccal fat pad removal would not obviate that desire, those concerns.
Okay, I want to switch gears a little bit. So, the American Academy of Facial, Plastic, and Reconstructive Surgery just sent out a report about how Gen Z is opting into plastic surgery procedures at record numbers.
Mm,
Is that you've seen in your practice? And
mm.
what other, in addition to buccal fat removal, what else in the facial aesthetics are these patients asking for?
Yeah, it is true. I mean, it's very popular among that age group, that generation. But it's probably not surprising that it's many times less invasive procedures than surgery. I mean, there are times when younger patients do want facial surgery. I mean, rhinoplasty in particular has always been done for patients kind of 16, 18 years and up. But some oh, and another one that is doesn't often get thought about, a facial procedure that's done for young patients, is ear surgery to treat prominent ears. But there are there are some procedures, like some patients are having eyelid surgery a little bit earlier than maybe we've seen in the past. Some patients may be having neck surgery earlier than we've seen in the past. But coincident with this higher demand in younger patients is been the development of technologies that are better and better able to deliver results in a minimally invasive way, and by that I mean somewhere between injectables and full surgery.
So, as the last question, what is exciting you most in the facial aesthetics field right now?
Well, I think that we have a more global understanding of facial aging, and a more granular and organic understanding of it, so we can deliver you know better, more natural results. A lot of people, you always hear that, oh, I don't want to look pulled too far. I don't want to look like windblown. But we're just able to, we understand what's going on better now. And so it's through a combination of surgery, skincare, some fat transfers, as I mentioned, to treat thinning fat over the years. We're able to restore a natural look to the face, or keep a natural youthful look to the face throughout the years.
Well, Dr. Tantillo, thank you so much for speaking with me today. This was extremely informative, and I know it was for our listeners too.
Oh, you're welcome.
Oh, of course. Yes. Please come back. And to our listeners, thank you for joining us. And be sure to subscribe to the MedCore Network for the latest plastic surgery practice podcast. And remember to visit plasticsurgerypractice.com for the latest industry news. Thank you.